fair that's going on. But first, we talk about preventative medicine. J. Paul, our director, if we can see our special guest. Dr. Yrui Cabeza makes a visit here to Triad Today. He is with Cornerstone Internal Medicine at Premier. Welcome, Doc. How you doing?
Very good, thanks.
Or should I call you Gramps? He revealed to me off camera you're a grandfather at the ripe old age of 49. This guy looks like he's 30. So whatever he's drinking, talking about preventive medicine, I'm going to start drinking. Whatever you eat, I'm going to eat it. But let's talk about preventative medicine. What are some of the chronic diseases that you come in contact with?
Well, we see a broad range of diseases, but normally the most common ones we deal with are hypertension, diabetes, COPD, of course, obesity.
Well, are a lot of these, let me ask a stupid question, are a lot of these absolutely preventable or things that you could do so that you don't get these conditions?
Many of them are preventable, especially, COPD is directly related to smoking, so that's clearly preventable. Some of the, heart conditions or diabetes either can be preventable or delayed as much as possible with good lifestyles issues.
And smoking is one of those things that across the board. It hurts the heart, it hurts the circulatory system, everything, right?
Brain, heart, kidneys.
What are some of the preventative measures in general that you recommend to patients? We can go specific disease if we want to, or you can talk in generalities, but what are some of the preventative?
First of all, there are lifestyle changes that we call, promoting healthy diet, trying to lose weight, quit smoking, stimulate exercise. Just walking helps a lot, reducing heart risk.
And we didn't rehearse this, but when you said just walking, I've always wanted to ask a doctor or a surgeon this question. What if you just didn't walk? What if you ate healthy? Why do doctors always say walk or get exercise?
Well, studies have shown that walking, for instance, in diabetics, type 2, just walking 1.5 to 2 hours a week can reduce your mortality. It helps with your sugar control, also your cardiovascular.
I didn't realize that. Okay, yeah. That's good to know. Thanks for answering that. All right, let me get back on track here with something. Let's talk about vaccines for a second. We know that with babies and infants and certain other populations that it's great. Vaccines are important. Important to inoculate. What about adults and various vaccines?
Oh, that's a very good question. I think vaccines are still important for adults. The ones that we promote the most are the flu vaccine, of course, and we're already given it in our practice. Also, we're promoting tetanus shot every 10 years.
Why is that?
Well, you can get sick if you get a nasty wound on any part. You still
so you don't just need one; you need to get those every so often.
No, you need to do a boost.
I didn't realize that. You need every 10 years.
Every 10 years.
Let me talk about colonoscopies. And my wife taught me into doing this a few years ago, and I was glad I did. But why are colonoscopies so important?
Well, colon cancer is the second leading cause of death in the United States. Of patients that get the disease, 1/3 died from the disease. And colonoscopy can be a way of preventing cancer because we know nowadays that colon cancer most of the time, not all the time, develops from polyps. It takes approximately 10 years from a polyp to become a cancer. So if you get rid of the polyp before the time, you're preventing cancer, basically.
That's good to know. And also because people talk about once you hit 50, you definitely should have it. Why do they mark that as sort of a magic age?
Because 90% of the cases present after 50 years old.
I want to go to a graphic here just before we run out of time. www.cornerstonehealth.com is something you want to check out and get all sorts of information about some of the things we were talking about. 10 seconds or less, if you had to pick one thing to make people change in their lifestyle, what would it be?
Quit smoking.
Good advice. Dr. Yrui Cabeza, will you come back sometime?
Of course.
Granddad?
Thank you. Nice
all
to meet
right,
you.
bring some pictures of the grandchild next time.
Okay, perfect.